we really want to complete the analysis of the open label extension and communicate the results. So an open label extension means that all trial participants who completed the trial, the double-blind trial, were given the option to receive AMX35 long-term. And that's important because the open label extension will teach us about the effects of the drug on survival, which is another important outcome in ALS. So we've been following participants in the context of this open label extension for as long as 3 years from now. And so I really look forward to sharing the results with you in the near future. I think that will be another important piece of evidence to really give us a good picture of the impact of AMX35. Well, we measured muscle strength and respiratory function. We also measured events such as death equivalent events, meaning tracheostomy or permanent assisted ventilation, and rates of hospitalization. Now, I should say that in the context of this trial, which was relatively small and relatively short, we didn't see statistically significant differences in these secondary outcomes. However, they all numerically trended in favor of AMX35. So I think that, because these measures are, especially measures of muscle strength and respiratory function, are more variable than the ALSFFRS-R, which is the most sensitive measure to measure disease progression in ALS, it's not completely surprising. So it's possible that in a larger trial, one could see statistically significant differences, but we were reassured by the fact that they all numerically trended in the right direction. In terms of survival and hospitalization, as I said earlier, this was a relatively short study, and really what we're interested in is to look at these outcomes in the context of the open label extension. That will provide more data to really be able to tell if AMX35 has an impact on survival.